The skills and knowledge needed to perform a job may be gained through education, training, or experience. Competencies are used to assess our skills and knowledge. This PowerPoint is dedicated to offering the respiratory therapist a resource for information about annual competency evaluations in the workplace. I have included links to videos, images, and research papers and other pertinent websites as educational references for review. The competencies listed on this PowerPoint are basically for an adult care hospital. Competency evaluation tools and hospital policies. AIDED is a communication framework for healthcare professionals to communicate with patients and each other in a way that decreases patient anxiety, increases patient compliance, and improves clinical outcomes. The acronym AIDED stands for 5 communication behaviors: acknowledge, introduce, duration, explanation, and thank you. Created by Studer Group as a foundational tactic for effective patient communication, AIDED is used by nurses, physicians, respiratory therapists, technicians, food service administrators, and all staff involved in patient and family encounters at the bedside and across the continuum of care. While keywords are important in AIDED, it is not a script. It is a simple, consistent way to incorporate fundamental patient communication elements into every patient or customer interaction. Using AIDED in healthcare facility. Examples of AIDED would be acknowledge, greet the patient by name, make eye contact, smile, and acknowledge family or friends in the room. Introduce yourself with your name, skill set, professional certification, and experience. Duration. Give an accurate time expectation for tests, physician arrival, and identify the next steps. When this is not possible, give a time in which you will be able to update the patient on the progress. Explanation. Explain step by step what to expect next, answer questions, and let the patient know how to contact you, such as the nurse call button. And finally, thank you. Thank the patient and/or family. You might express gratitude to them for choosing your hospital or for their communication and cooperation. Thank family members for being there to support the patient. Using a consistent conversation framework helps physicians and staff anticipate the needs of patients and their families so that they can meet and exceed the level of care patients expect. After more than 15 years in practice at hospitals, health systems, and medical practices, AIDED has proven to improve patient and customer perception of care or service, decrease anxiety for staff and patients, and increase compliance, resulting in better clinical outcomes, build patient and customer loyalty, and ensure service providers deliver consistent measures of empathy, concern, and appreciation. Associate health measurable behaviors. Employees should be able to verbalize understanding of annual PPD testing policy for tuberculosis, verbalize policy and procedure for needle sticks and exposure to communicable infections and/or diseases, demonstrates understanding and usage of standard universal precautions, and verbalizes policy and procedure for employee falls or injuries. For more information regarding needle sticks, employee falls or injuries, or tuberculin skin testing, please click on the following links below. Clinical documentation. Employees should be able to identify different electronic and paper documentation procedures throughout the hospital. Identify departmental documentation forms when electronic documents are unable. Understand that all paper documentation forms must have patient labels. Understand documentation requirements throughout the hospital. Identifies appropriate locations within EMR for documentation purposes, and understands ventilator documentation requirements. At this point, you're probably asking yourself, hasn't accurate documentation always been important? The answer is invariably yes. However, in the last few years, some major changes in how hospitals are billed have pushed clinical documentation to the forefront of healthcare conversations. Here are just a few reasons why clinical documentation has been in the spotlight. Overpayments and underpayments are a huge problem. The Recovery Audit Program resulted in more than $990 million in overpayments being returned to Medicare Trust Fund and almost $38 million in underpayments returned to healthcare providers in just 3 years, according to the U.S. Centers for Medicare and Medicaid Services from 2005 to 2008. Due to these astounding discrepancies, Congress instituted a permanent nationwide recovery audit program. Clinical documentation affects a hospital's bottom line. Healthcare is rapidly transforming from a fee-for-service to a pay-for-performance payment system that relies heavily on clinical documentation to support payment. Whereas in the past, providers were predominantly reimbursed based on volume of services, now the focus is on the quality of services provided. Patient bills are also affected by correct documentation. Correct documentation is not only important for hospital reimbursement, but also for ensuring that patient bills are accurate as well. Clinical documentation improvement and billing specialists help ensure hospitals, physician practices, and patients are correctly billed for the care provided. Nothing is more frustrating than getting home from the grocery store to discover your receipt says you were incorrectly billed for something you purchased. Now imagine that frustration amplified to a level where hundreds, if not thousands of dollars are at stake. Patients deserve to be billed correctly for the services and procedures they receive, just as providers and facilities deserve to be paid correctly for their hard work. Clinical documentation helps promote accuracy, which is important for patient care. The need to have complete, accurate documentation is significant to a patient for continuing care, patient safety especially. Poor documentation that is completed in a hurried fashion will not lend itself to continuing care by other providers. Imagine if that patient goes on vacation and acquires a traumatic injury. In such an event, the hospital attending to this patient will need accurate, complete documentation about the patient's history, pacemaker, and more in order to proceed in a safe and beneficial manner. Cultural competence. Caring for a culturally diverse population has become common throughout the world. If we are going to decrease healthcare disparities, we need to pay attention to cultural values, beliefs, and practices. If we do not adapt our healthcare delivery system to include these diverse practices, the results are the compromise of patient care, poorer health outcomes, and an increase in the cost of healthcare. Many resources, skills, and knowledge are needed to effectively care for the diverse populations throughout the world. Our biggest goal in understanding the need for cultural competency is improving patient satisfaction and outcomes. Healthcare disparities across ethnic, social, and economic groups are evidence enough for the need of healthcare providers to be attentive to cultural diversity and cultural competency. Training helps us better understand and become competent in caring for different populations. For more information on cultural competence, please click on the following links below. HIPAA and your privacy. At Mercy Health, your privacy and confidentiality are taken very seriously. The Health Insurance Portability and Accountability Act safeguards your private information and protects you and your family as a patient of our hospital. Hospital compliance with HIPAA is not optional. Penalties for failing to comply with regulatory requirements or for the wrongful disclosure of protected health information can be severe, with fines and prison sentences resulting from the most serious violations. Compliance with HIPAA guidelines also provides healthcare institutions with improved administrative efficiencies, reduced paperwork by promotion of electronic standards, reduced cost, and more assurance that healthcare information remains available, confidential, and safeguarded. Patients who require isolation during their hospital stay may become depressed and agitated, which can adversely affect their recovery. not to mention patient satisfaction scores. But with the right communication tools, this problem can be avoided. Isolation keeps the spread of contagious illnesses down in the hospitals. The word isolation can conjure up images of solitary confinement. It may hurt patients' morale, which can hinder their recovery and lead to poor outcomes. So it's key to get this impression out of patients' minds. First off, it's important to explain the differences between the types of isolation to patients and their families. That way, they won't get upset when a doctor comes in wearing a mask or they are placed on a separate floor. After giving patients and their families this basic information about the type of isolation they will be experiencing, it's important to address their fears and concerns. All hospitals in the state use the same procedures for isolation. Staff can give patients and their families color-coded fact sheets about each type of isolation. Information on these sheets includes a basic rundown of the type of isolation, the reasons why it's necessary, and what patients and their families need to do to prevent germs from spreading throughout the hospital stay. The state also has come up with a list of frequently asked questions clinical staff can distribute as well. Being proactive when it comes to letting patients know about isolation procedures, rather than just putting them in place with no explanation, can work wonders with making patients feel more at ease. While the procedures may be familiar to workers who use them regularly, most patients don't have the same perspective. So taking the time to let them know why isolation is a must with their illness can be critical to their well-being while in the hospital, which can have ripple effects down the line. For more information on isolation policies and measurable behaviors, please click on the following link below. Patient identification, measurable behaviors. Employees will utilize AIDIT upon entering the room. Wash and sanitize hands. Demonstrate proper knowledge of HIPAA and patient privacy. Demonstrate use of 2 unique patient identifiers. And demonstrate proper knowledge of scanning patient armband and medications prior to administration when applicable. Checking for patient identification can sometimes frighten the patient. Already fearful from having to seek medical attention, it's important to offer reassurance that by checking their identification, you are looking out for their safety. This can be done by verbalizing intent. For example, Mrs. Jones, I am checking your armband for safety. This simple statement, verifying an action that is done multiple times a day, communicates that she is being properly cared for. Mercy Health employees. Employees should act with professionalism, dress in a way that inspires trust and confidence in patients and families, be courteous, helpful, and professional when using the telephone, respond to the requests of others as quickly as possible, and protect the confidentiality of professional and personal information. Mercy Health employees should also promote teamwork, offer help to others, participate in group decisions, and be positive about the work and the work environment. Mercy Health employees should be courteous, treat others with kindness and respect, regardless of how others behave, give others an opportunity to speak and listen to what they have to say, be polite, and demonstrate awareness of how his or her words and actions affect the feelings of others, be patient and forgiving when things go wrong, and support and value a multicultural environment. Communication is key when working in healthcare. You should always greet others in a manner that helps them feel welcome, take the time to explain things clearly and completely, and offer others the opportunity to ask questions and respond using words that they can understand. Substance abuse and fitness for duty. While working at Mercy Health, understand that the following activities are prohibited while an applicant or employee is on the facility premises or otherwise engaged in facility business. The manufacture, possession, use or sale, distribution, dispensation, receipt, or transportation of any drug other than as required of an employee to complete job-related duties, or the consumption of alcohol except moderate consumption at facility-sponsored events where authorized. Understand that testing for alcohol, illegal drugs, and controlled substances, is an important part of a safe facility environment. Understand that in addition to pre-employment drug screening, the facility may also conduct substance screens under any of the following circumstances subject to applicable laws: randomly on the job inquiry, when a controlled substance is missing, when an employee is suspected as being unfit for duty, or when an employee returns from a leave of absence of 90 days or more. Understand that compliance with this policy is a condition of employment. Failure or refusal to cooperate fully, submit to any inspection or testing, or follow any prescribed course of substance abuse treatment will be grounds for discipline up to and including immediate termination. Aerosol nebulizer breathing treatments. An employee should be able to demonstrate proper preparation and assembly of equipment, apply knowledge, understanding, and troubleshooting skills to aerosol systems for adult, pediatric, and neonatal patients, check, order, and retrieve appropriate medication, and verify patient and explain the procedure to the patient and family, acknowledging length of treatment and instruct in proper technique. Properly assess the patient, checking for heart rate, respiratory rate, and breath sounds before, during, and after the treatment is needed. Documents therapy appropriately. The link below is a short video on how to perform a treatment correctly. Arterial blood gases, ABGs. An employee should be able to verify order and patient, gather supplies, patient label and number, explain the procedure to patient, utilize standard universal precautions, palpate radial pulse as first site of choice, and perform Allen's test or modified Allen's test. Obtain specimen using proper technique and preparation for radial, brachial, and femoral punctures. Apply firm digital pressure to the puncture site for 5 minutes or 10 minutes if patient is receiving treatment with anticoagulants. Label specimen and patient's presence with date and time obtained, puncture site, amount of oxygen patient is receiving if applicable, and initials of therapist. And be able to enter all required data into the blood gas analyzer prior to instilling blood. Report panic critical values to appropriate personnel. Properly enter results into the electronic medical record. Document procedure appropriately. Follow the links below to practice ABG interpretation and brush up on your technique. BiPAP, bilevel positive airway pressure. Employees should be able to verify order and patient, gather necessary equipment and utilize standard universal precautions, explain the procedure to the patient and family, demonstrate knowledge of the appropriate settings and controls for IPAP, EPAP, AVAPs, rate, FiO2, and rise time. Be able to perform a machine parameter check and assessment for redness on patient's nose or face. Assemble and attach patient circuit and filter. Apply and position headgear with minimal leak. Perform a machine parameter check and assessment for redness on patient's nose or face using Liquicell, Mebiplex, or Duoderm, and use of smart phrase to document. Demonstrate steps to adjust and verify alarm settings and parameters. Document therapy appropriately, including, but not limited to, patient tolerance, breath sounds, pressure, flow, FiO2, heart rate, respiratory rate, and oxygen saturation. CPAP, continuous positive airway pressure. Be able to set up CPAP machine, mask, nasal prong or pillows, and or headgear. Identify indications and contraindications for CPAP. Perform a machine parameter check and assessment for redness on patient's nose or face using the Liquicell, the Mebiplex, or Duoderm, and use of smart phrase. Verify and set alarm parameters and document appropriately, including tolerance, pressure, flow, FiO2, heart rate, respiratory rate, and oxygen saturation. Follow the links below for more information regarding education on BiPAP, CPAP, and modes. Chest physiotherapy. Employees should be able to verify orders, patient, and check chest x-ray. Explain procedure to the patient and family. Demonstrate knowledge of the various patient positioning for therapy. Demonstrate knowledge of proper hand percussion, percussor, and palm cup used in placement for lung percussion. Demonstrates proper duration of therapy, and documents therapy appropriately. Chest physiotherapy, VEST. Employees will be able to check orders and patient's chest x-ray, verify patient, explain procedure to patient and family, choose appropriate size vest for the patient, position them correctly, and demonstrate correct hookup of vest, equipment, and supplies. Demonstrate proper duration of therapy and document therapy properly. The following is an educational video on using vest therapy by Hillrom. I have no affiliation with Hillrom. This is for educational purposes only. Code Blue, Code Pink, and Rapid Response Team. Employees will be able to demonstrate knowledge of BLS, ACLS, PALS, and/or NRP. Verbalize the appropriate indications for calling a Code Blue, Code Pink, and/or RRT. Appropriately activates a code or RRT and delegates care of other assigned patients as appropriate during the code or RRT. Assure that all emergency equipment is available at the bedside and initiates life-saving interventions as the team responds. Provide brief report to the responding team and allow responding team members to assess and make recommendations for direct care. Coordinate efforts with responding team and document care given during code or RRT appropriately. For more information on Code Blue, Code Pink, and Rapid Response, follow the following links below for BLS, ACLS, PALS, NRP, and RRT. Entitle CO2. Employees will be able to identify indications for procedure, demonstrate ability to place sampling line between ventilation device and airway device if intubated, or using LMA or cuff tracheotomy to ventilate, resuscitate the patient. Demonstrate ability to place sampling line on spontaneously breathing patients, and demonstrate ability to hook up all sampling devices to the cardiac capnography monitor and turn on the feature as well as setting the alarm limits. Demonstrate understanding of waveforms, knowledge of normal and tidal CO2 ranges, understanding that during ventilation of a patient perfusion, a rise in CO2 indicates too slow ventilation, and understand that during ventilation of a patient with perfusion, a decrease in CO2 indicates too fast ventilation. Demonstrates understanding that during ventilation of a patient without poor perfusion, a suddenly high CO2 reading may indicate a return of spontaneous circulation, and understand that during ventilation of a patient without poor perfusion, a chronically low CO2 is expected, and prolonged situations may indicate cardiac arrest or poor cuff seal. Demonstrate understanding that during CO2 monitoring of a spontaneously breathing patient, a low CO2 reading indicated hyperventilation or shallow ventilation. Understand the difference between tachypnea and hyperventilation, as well as bradypnea and hypoventilation. Document appropriately, and if you would like more information, follow the link below for this end title video. Incentive spirometry. An employee will be able to verify order and patient, explain procedure to patient and family, set incentive goal based on patient, sex, age, and height, instruct patient in the proper usage of the incentive spirometer, instruct patient on proper coughing technique, and documents therapy appropriately. Follow the following links for a video and research paper regarding incentive spirometry. Intubation and airways. An employee will be able to appropriately select proper oral and nasal airways and verbalize proper technique and insertion for each. Demonstrate proper technique for head tilt and chin lift airway opening maneuvers. able to appropriately select proper size of ET tube, and demonstrate ability to gather and assemble equipment and supplies for endotracheal intubation. Demonstrate and verbalize knowledge of landmarks and proper technique for correct tube insertion and placement. Monitor patient during and after the procedure. Perform or assist in endotracheal intubation. Understand readings for end-tidal CO2 detection devices, and document procedure appropriately. When using airways, be able to appropriately select proper oral, nasal, and endotracheal airways. Verbalize proper technique for insertion of oral, nasal, and endotracheal airways. Monitor patient during and after the procedure. Gather and assemble equipment and supplies for endotracheal intubation. Assist in endotracheal intubation, and document insertion, placement procedure for various airways. Follow the following links for more information regarding intubations and airways. Metered dose inhalers, MDI, administration via common canister. Employees will be able to check orders and retrieve appropriate medication via metered dose inhaler from the automated dispensing cabinet, or Pyxis. Retrieve a one-way valved holding chamber, or spacer, to administer MDI to patient. Cleans the MDI mouthpiece and canister with an alcohol wipe prior to attaching the spacer. Attach the MDI to the spacer once it has been cleaned with alcohol. Explain procedure and instruct proper technique, including patient exhalation prior to MDI administration, breath hold after MDI administration, and mouth rinsing as needed post-MDI administration. Check for heart rate, respiratory rate, and breath sounds before, during, and after the treatment is needed. Remove the MDI from spacer and clean the mouthpiece and canister with an alcohol wipe. Understand that dry powdered inhalers and nasal inhalers are not used with spacers and are excluded from the common canister policy. Understand that patients under isolation precautions are also excluded from the common canister policy. For more information regarding metered dose inhalers administration via common canisters, please follow the following links below. Oxygen therapy. An employee will be able to verify order and patient. Explain therapy to the patient and family. Retrieve and assemble all necessary supplies and equipment. Apply knowledge, understanding, and troubleshooting skills to gas delivery systems for adult, pediatric, and neonatal patients. Demonstrate understanding of various oxygen administration devices, low, medium, or high flow, and the appropriate uses and setup for each one, such as nasal cannulas, simple face mask, reservoir mask, and air entrainment mask. Demonstrates knowledge of when humidity or heat should be added to therapy. Explain benefits and hazards of therapy to the patient. Initiates titration and weaning according to protocol and policy. Understands documentation requirements throughout the hospital and documents in the EMR appropriately. Knows documentation charging is to be completed within the assigned shift. For more information regarding oxygen therapy, please follow the following link for a YouTube video. PAP, PEP, EasyPAP, and ACPEP therapy. Employees will be able to demonstrate proper preparation and assembly of equipment. Explain the procedure to the patient and instruct in proper technique. Assess the patient, document therapy appropriately, adjust device to achieve desired pressure level, and demonstrate knowledge of basic and advanced concepts of therapy. TheraPEP therapy. Employees will be able to demonstrate proper preparation and assembly of equipment. Devices used are the Acapella and TheraPEP. Explain the procedure to the patient and instruct in proper technique. Assess the patient, document appropriately, adjust device to achieve desired pressure, demonstrate knowledge of basic and advanced concept of therapy. Follow the links below for more information about PAP, PEP therapy, EasyPAP, and ACPEP therapy. Patient assessment. Employees will be able to verify orders and patient, review history and physical information, review relevant medications, lab studies, and diagnostic tests, identify abnormal findings and current therapy, verbalize understanding of arterial blood gas interpretation, identify indications for therapy, and position patient correctly. Inspect chest and note breathing patterns, auscultate each lobe of both lungs, measure pulse rate and respiratory rate, determine presence or absence of signs of respiratory distress, and recognize warning signs that require notification of nursing staff and or physician changing therapy and or medication. Specifies process for discontinuation of therapy if patient meets therapy goals and or no longer meets criteria for therapy. Obtain a pulse oximetry measurement and record findings in the medical record. For more information on patient assessment, please follow the following link for the YouTube video on patient assessment. Peak flow meter. Employees will be able to demonstrate proper understanding of peak flow meter usage and application. Explain the procedure to the patient. Instruct patient on proper technique, including sit, stand up straight, breathe in as much as possible, close lips tightly around the mouthpiece, blow out as fast and hard as possible, and determine patient's predicted peak flow measurement by measuring the patient's height and age using the peak flow guide. Follow the YouTube link below to learn more about how to use a peak flow meter. Pulmonary function test. Employees will be able to verify order and patient, perform calibrations, explain the procedure to the patient, family, and instruct patient on proper technique, acquire a good history, acquire patient's height and weight, and communicate well with the patient. Demonstrate knowledge of equipment usage and setup, determine if post-spirometry is indicated, perform basic spirometry including pre- and post-bronchodilator with or without body box, perform DLCO and or FRC lung volumes, perform a methylcholine challenge test, and print out report. Be able to distinguish a physician's order to determine what type of study is needed, document a summary of the procedure and for charging purposes. Demonstrate understanding of the filing process once the test is read by a physician. The following 5 YouTube videos are links for education regarding PFTs. Pulse oximetry. The employee will be able to demonstrate understanding of equipment usage, demonstrate proper analysis of oximetry values, demonstrate knowledge of various sensor placement sites for the patient, understands the difference between reusable and disposable sensors and the proper uses for each. Documents appropriately. For more information regarding pulse oximetry, please follow the following YouTube link below. Respiratory medications. Employees will be able to verify order and patient, identify indications for anticholinergics, corticosteroids, mucolytics, vasoconstrictors, anti-asthmatics, and anti-infective agents. Therapists must be able to identify adverse drug reactions for respiratory medications, document medication delivery within the patient's medical record, document patient response to the medication or treatment, and notify the physician when necessary. If you would like more information regarding aerosol therapy, please click on the link below for a guide on aerosol therapy. Sputum collection. A therapist must be able to gather equipment and supplies, demonstrate proper equipment, setup and usage, explain the procedure to the patient and family, position the patient correctly, and understand the usage of aerosol treatments and CPT to induce a sputum specimen. Label specimen in the patient's presence with date and time obtained and initials of collecting individual as well as a patient label. Handles hazardous sputum specimens correctly and transports to the laboratory appropriately. Documents procedures appropriately. For more information regarding sputum collection, please follow the following YouTube link below. Suctioning. A therapist will be able to gather equipment and supplies, Assess airway and demonstrate understanding of indications. Explain procedure to the patient and family, and demonstrate proper equipment setup. Explain the procedure to the patient family if applicable. Adjust suction pressure to appropriate level for adults. Position patient correctly. Hyperoxygenate patient if on a ventilator. Demonstrate sterile technique. Use normal saline when necessary. Oxygenates patient and uses standard precautions to dispose of equipment and supplies. Verbalize time limit per suction event. Know the side effects and contraindications of suctioning, and document appropriately. For more information regarding suctioning, follow the following YouTube link below. Tracheostomy care. A therapist will be able to demonstrate knowledge of tracheostomy cleaning and care. Demonstrate proper trach removal and reinsertion during the changing process. Demonstrate knowledge on intercannula placement and removal, and demonstrate understanding of tracheostomy button or valve. For more information regarding tracheostomy care, please follow the following YouTube link below. Ventilator initiation and therapy. A therapist will be able to complete proper system setup with or without external heater. Perform appropriate self-tests prior to patient use. Explain function of all settings and displays on the selected ventilator. Explain all hazards and complications associated with mechanical ventilation, and assure correct ventilator assembly and setup. Initiate appropriate ventilator settings as ordered or per protocol. Place patient on ventilator and ensure immediate and appropriate volume and pressure return. Set appropriate alarm values and test for maximum audibility. Adjust peak flow for patient comfort and or to keep peak inspiratory pressures less than 35 centimeters of water and i.e. more than 1 to 2, unless otherwise ordered by physician. Perform complete ventilator check according to policy both on paper and in the EMR. Ventilator protocols and weaning. Therapists will be able to verify orders and patient. Identify responsibilities of respiratory care regarding the patient's ventilation status. State the criteria necessary to implement ventilator management protocols. Identify the appropriate protocol form according to the diagnosis, and set initial vent parameters according to the patient's condition. States the amount of time needed to assess the patient's response to the ventilator settings to obtain ABGs. Identifies the patient assessment criteria according to the diagnosis. Understands the interventions necessary to correct parameters that fall outside normal ranges, and identifies the protocol ranges in which ventilator changes will be made according to the diagnosis. Identifies and understands the clinical integration or decision tree and applies it when problems with patient comfort, hemodynamics, lung mechanics, oxygenation, and ventilation exist. States where all ventilator changes will be documented, and understands that the ventilator management protocol will be followed at all times unless a physician writes a specific order for intervention or end to the protocol. For more information on ventilator protocols and weaning, please follow the following YouTube video below, as well as 2 journal articles. This concludes my PowerPoint presentation. I hope you enjoyed it as much as I did creating it. You are never too old to set another goal or to dream a new dream. I hope you have a great day.